The following is episode 2 of a 2-part podcast series produced by the Canadian Generic Pharmaceutical Association that explores the impact of COVID-19 on Canada's prescription drug supply and what we need to do to ensure we continue to have access to the prescription medicines we need. In this episode, host Hugo de Grandpre and CGPA's president Jim Keon discuss international factors that affect Canada's supply of prescription drugs and the need for Canada to identify and stockpile essential medicines so that we are better prepared for future health emergencies.
Hi, Jim. Nice to talk to you again. We discussed during our last episode the solutions that the Canadian generic pharmaceutical industry put forward in its blueprint to grow and expand Canada's domestic pharmaceutical industry when it comes to supplying Canadians with good, affordable medicines, including in times like these. So today I'd like to talk a little bit more about other aspects of the blueprint, mainly the supply chain and the need to stockpile certain products. So if we start with the supply chain, could you tell us a little bit more about the current system, its complexity, and how it affects the products that are available for Canadians?
Canada is fortunate to have a strong industry. We supply almost 3 out of 4 medicines in Canada. These are developed around the world. Many of the starting agents are developed in China and in India, but we also have products coming from Europe, from the United States, from South America. It's truly a global industry. And in a pandemic, it really highlighted the fragility of the international supply chain. So we saw plants closed in India and elsewhere. We saw European countries saying to their domestic manufacturers of medicines, you can't export until you demonstrate that you're going to have enough products for the domestic use. We saw the United States put on restrictions with N95 masks. So we want to build up our domestic industry, a domestic industry that in 3 to 5 years from now is stronger. We've got more plants, more production, more employment. But going forward, we have to recognize that we're never going to be able to make all of these medicines. So trying to strengthen the international supply agreements we have is important for us. Trying to ensure that governments, companies play fairly, equitably. And we've been talking to our federal government about that.
But did Canada have a sufficient supply of certain products that were in high demand during the first wave? And if not, what should be done?
We found Canada didn't have a proper supply of necessary crucial medicines. The COVID-19, we saw a tremendous increase in the number of patients in intensive care units. These patients were requiring ventilation 24 hours a day, 7 days a week. That requires medication to relax the patients. We didn't have stocks of those medicines. They're the same medicines that all countries around the world wanted. So there was a bidding war and allocation procedure going on. So we think that Canada should take some measures to have necessary stock before another health emergency starts. Again, we have been talking to both the federal government as well as Ontario and Quebec, where our industries are centered, about the possibility of working together to increase our capacity to refocus some of our plants on the necessary medicines, and also ensuring that we have safety stocks and also a strong supply chain to provide them going forward.
Okay, well, I'd like to quickly come back to pricing, which we discussed a little bit during the first episode, and the obstacles to build a sustainable domestic industry. So does the current pricing framework in Canada allow for enough flexibility for manufacturers to adapt and to meet the demand efficiently?
We have an agreement with the PCPA, Generics 2.0. We're in the middle of that now. That was all, of course, pre-COVID, pre-pandemic. I think the fact that we have this agreement is useful, but going forward, we see the need for some flexibility in that agreement. In other countries where they don't have quite the same kind of regulatory restrictions, companies are able to respond a little faster. So if their costs, input costs or transportation costs increase, they're able to increase their pricing, where in Canada, our prices are fixed. I think going forward, our agreement needs to be looked at and made more flexible to continue to develop our industry.
I would like to conclude, Jim, by asking you what's your main message to Canadian governments, whether provincial or federal, when it comes to the blueprint and the measures that you are putting forward?
Yeah, I think our main message is that the generic industry is a key sector in Canada. We provide 75% of prescription medicines to Canadians. We provide quality products at very, very competitive prices. We would like to participate with the governments in developing a strategy on how to ensure that our industry grows, develops, becomes stronger, and better able to supply medicines to Canadians. We want to grow domestically. We want to strengthen the international supply chain. We want Canada to identify critical medicines and to build safety stocks at the federal level. So we've identified many measures in our blueprint that we think will take us towards those objectives. In a sentence, we want to be seen as a key strategic sector, and we want measures in place to help support our growth to provide our medicines to Canadians at good prices.
Thank you very much for joining me today, Jim.